In this video, we will cover hypotension or low blood pressure. Systemic arterial blood pressure is the pressure exerted on the walls of the arteries during ventricular systole and diastole. It is affected by factors such as cardiac output, distension of the arteries, the volume, velocity, and viscosity of the blood. Measuring blood pressure involves two numbers. Systolic, it is the top number. This is the pressure on the arteries each time the heart beats. Diastolic pressure, that is the bottom number. This is how much pressure the arteries are under between the heartbeats. A normal BP in adults is considered a systolic BP less than 120 mmHg over a diastolic BP less than 80 mmHg. Hypotension refers to an abnormally low systolic and diastolic BP that can result in lightheadedness or fainting. Hypotension or low blood pressure is when the blood pressure is much lower than expected. Low blood pressure is a condition in which the force of the blood pushing against the artery walls is too low. It can happen either as a condition on its own or as a symptom of a wide range of conditions. Hypotension is a decrease in systemic blood pressure below accepted low values. While there is not an accepted standard hypotensive value, pressures less than 90 by 60 are recognized as hypotensive. It really depends on people. What's considered low blood pressure for one person might be okay for someone else though. Low blood pressure might cause no symptoms that client notice, but when it does, client may need medical attention, or it might cause dizziness and fainting. Hypertension may be mild, serious, or sometimes low blood pressure can be life-threatening. Now we will see the causes of hypotension. Many systems of the body, including organs, hormones, and nerves, regulate blood pressure. For example, the autonomic nervous system sends the fight or flight signal that, depending on the situation, tells the heart and other systems in the body to increase or decrease blood pressure. There are many possible causes of low blood pressure. BP may be low because clients are fit and healthy, or client may have inherited it from the parent. Some people develop low blood pressure as they get older. Blood pressure varies throughout the day. It depends on what clients are doing and how clients are feeling can also affect it. Blood pressure depends on body position, breathing, food and drink, medicines, physical condition, stress, time of day. Blood pressure usually is lowest at night and rises sharply on waking. Hypotension can happen for a wide range of reasons. Medical conditions that can cause low blood pressure include pregnancy. Changes during pregnancy cause blood vessels to expand fast and may cause blood pressure to drop. Orthostatic hypotension is possible in the first and second trimesters of pregnancy. Bleeding or other complications of pregnancy can also cause low blood pressure. Low blood pressure is common in the first 24 weeks of pregnancy. After a person gives birth, blood pressure usually returns to the level that it was before pregnancy. Next is heart problems, which can lead to low blood pressure include irregular heart rhythms, that is arrhythmias. Client can get hypertension when the heart beats too quickly, that is tachycardia, or too slowly, that is bradycardia. Widening or dilation of the blood vessels can cause hypotension. A heart attack, heart failure, and heart valve disease can also cause low blood pressure. Next is lung problem. Client can get hypertension if the lungs aren't working as they should, and if the client is having pulmonary embolism and collapsed lung. In such condition, the person may have hypertension. Life-threatening allergic reactions or immune reactions to severe infection, that is sepsis, can also cause hypotension. Anaphylactic shock is an allergic reaction that can lead to death. It can happen in people who are highly sensitive to drugs such as penicillin. It also can happen after eating certain foods or being stung by a bee or wasp. Symptoms of a severe allergic reactions include a sudden and a large drop in blood pressure. Septic shock occurs when bacteria from an infection enter the bloodstream. The bacteria then produce toxins that affect the blood vessels. This can lead to dangerously low blood pressure. Next cause is endocrine conditions or hormone-related diseases. Endocrine problems that affect certain glands that make key hormones may cause blood pressure to drop. These are underactive thyroid, that is hypothyroidism, Addison's disease. Low blood sugar, also called hypoglycemia, may lower blood pressure too. So might diabetes also. Low blood volume or blood loss. Losing a lot of blood also reduces blood volume, leading to a severe drop in blood pressure. Causes of serious blood loss include injuries and internal bleeding. Blood loss from severe injuries can cause low blood pressure. Next condition is dehydration. When the body doesn't have enough water, the amount of blood in the body declines. This can cause blood pressure to drop. Fever, vomiting, severe diarrhea, overuse of diuretic medicines and strenuous exercise can lead to dehydration. Severe infection. When an infection in the body enters the bloodstream, it can lead to a life-threatening drop in the blood pressure called septic shock. Another name for an infection that happens when germs get into the blood and spread is septicemia. Next cause is lack of nutrients in the diet. Low levels of vitamin B12, folate and iron can keep the body from making enough red blood cells. A lack of healthy red blood cells is called anemia and it can lead to low blood pressure. Next cause is because of the central nervous system disease. Problems with the autonomic nervous system, such as in Parkinson's disease, can affect the blood pressure control and can cause low blood pressure. People with these conditions may feel the effects of low blood pressure after eating because their digestive systems use more blood as they digest food. Hypotension can happen with medications that treat high blood pressure, heart failure, erectile dysfunction, neurological problems, depression, and more. Don't stop taking any prescribed medicines unless the provider tells client to stop. Recreational drugs can lower the blood pressure, as can alcohol. Certain herbal supplements, vitamins, or home remedies can also lower the blood pressure. This is why clients should always include these when clients tell the healthcare provider what medications clients are taking. Being too hot or too cold can affect hypertension. Some over-the-counter medications, liver disease, bed rest for long periods can cause low blood pressure. What causes a sudden drop in blood pressure? A sudden drop in blood pressure can be life-threatening. Causes of this type of hypertension include loss of blood from bleeding, low body temperature, high body temperature, heart muscle disease causing heart failure, sepsis, that is a severe blood infection, severe dehydration from vomiting, diarrhea or fever, a reaction to medication or alcohol, a severe allergy reaction called anaphylaxis that causes an irregular heartbeat. Next, we will see pathophysiology. Blood pressure is modulated via two primary mechanisms, that is cardiac output and total peripheral vascular resistance. Blood pressure is defined as blood pressure is equal to cardiac output into total peripheral vascular resistance. Therefore, any disease of pathology that impacts one or more of these parameters will induce hypotension. The heart functions as a pump system to generate a pressure gradient for the distribution of blood throughout the body. This pumping potential is referred to as the cardiac output. Cardiac output is a product of stroke volume and heart rate. Disease that reduce stroke volume or heart rate will decrease the total cardiac output of the heart, functionally decreasing the ability to generate blood pressure. Disease states include arrhythmia, valvular regurgitation, valvular stenosis, diastolic or systolic heart failure, large volume losses of blood, and cardiac tamponade. Various medications also capable of inducing hypertension. Most notorious for decreasing heart rate are the beta blockers and calcium channel blockers. Diuretic medications are also possible sources that decrease cardiac stroke volume. Systemic vascular resistance, also known as total peripheral vascular resistance, is the amount of force exerted on circulating blood by the vasculature of the body. Three factors determine the force: the length of the blood vessels in the body, the diameter of the vessels, and the viscosity of the blood within them. Peripheral vascular resistance is the resistance in the circulatory system that is used to create blood pressure, the flow of the blood, and is also a component of cardiac function. When blood vessels constrict, this leads to an increase in SVR. When blood vessels dilate, this leads to a decrease in SVR. Systemic vascular resistance is equal to 80 into mean arterial pressure minus mean venous pressure divided by cardiac output. Blood pressure is continuously regulated by the autonomic nervous system using an elaborate network of receptors, nerves, and hormones to balance the effects of the sympathetic nervous system and the parasympathetic nervous system. The sympathetic nervous system acts to raise the blood pressure by increasing the heart rate and constricting arterioles. The parasympathetic nervous system lowers the blood pressure by decreasing the heart rate and relaxing arterioles to increase vessel diameter. A decrease in arteriolar caliber or diameter increases the resistance to blood flow, thus increasing the blood pressure. Conversely, increasing the diameter of terminal arterioles will decrease resistance to blood flow, thus decreasing the blood pressure. The vast and rapid compensation abilities of the autonomic nervous system allow normal individuals to maintain an acceptable blood pressure over a wide range of activities and in many disease states. Therefore, the absence or blunting of autonomic input by medications or disease states or even small alterations in these networks can lead to hypotension. Both cardiac output and total peripheral vascular resistance function as feedback compensation mechanisms for the other in healthy individuals. When cardiac output decreases, peripheral resistance should increase via constriction of terminal arterioles to decrease vessel caliber to maintain blood pressure. When peripheral resistance decreases, cardiac output will increase via increased heart rate to maintain blood pressure. Acute disease processes that are life-threatening and are classified depending on etiology as distributive shock, cardiogenic shock, hypovolemic shock, obstructive shock, or a combined type hypotensive shock. Distributive shock occurs as a failure of the ability to maintain total peripheral resistance with maintained cardiac function, attempting to compensate. This classically presents with warm extremities and skin, edema, increased mucus secretions, and tachycardia. This is classically associated with anaphylactic allergic reactions and septic shock. Cardiogenic shock is a failure to achieve sufficient cardiac output with maintained total peripheral resistance. Classically, these patients present with cool, dry extremities and skin with bradycardia. Hypovolemic shock is a loss of total blood volume such that the blood pressure is not maintained. Both cardiac output and total peripheral resistance are maintained. This is possible via trauma with massive loss of blood or overuse of diuretic medications with fluid volume loss via urine. Cortisol deficiency, as seen in Addison's disease, leads to a loss of fluid via urine and a relative cortisol deficiency. Sheehan syndrome is postpartum pituitary necrosis, leading to a loss of many pituitary hormones as a result of postpartum shock or hemorrhage. Obstructive shock occurs with the obstruction, constriction, or compression of the cardiovascular system such that the blood flow does not efficiently occur or there is a decrease in stroke volume of the heart. This leads to a relative drop in blood pressure systematically. Obstruction may occur secondary to pulmonary embolism, tension pneumothorax, cardiac tamponade, constrictive pericarditis, or some other restrictive cardiomyopathy. These will classically present with signs of congestive heart failure, including distended jugular veins, peripheral edema, pulmonary crackles, quiet heart sounds, or pulses paradoxes. Hypotensive shock is also possible via any combination of the above pathologies occurring simultaneously. One example is Waterhouse-Friderichsen syndrome, which is an adrenal gland failure due to frank hemorrhage into the adrenal gland secondary to bacterial infection by Neisseria. This leads to a host of hypovolemic and distributive shock symptoms. Now we will see the types of low blood pressure. Hypertension is classified based on the biometric parameters of the blood pressure measurement. It may be absolute with changes in systolic blood pressure to less than 90 mmHg or mean arterial blood pressure less than 65 mmHg. There are several types of low blood pressure, which include orthostatic hypotension, also called postural hypotension, which means a sudden drop in blood pressure, most often happen with a decrease in systolic blood pressure of 20 mmHg or greater, or decrease in diastolic blood pressure of 10 mmHg or greater on position changes from lying or sitting position to standing. It happens when the cardiovascular or nervous system doesn't react appropriately to sudden position changes. This type of low blood pressure usually lasts only for seconds or minutes. Causes include dehydration, long-term bed rest, pregnancy, certain medical conditions, and some medicines. This type of low blood pressure is common in older adults. Next type is postprandial hypotension. This drop in blood pressure occurs 1 to 2 hours after eating. It is thought to be caused by blood pooling into the vessels of the stomach and intestine for digestion. It tends to happen after large meals containing lots of carbohydrates. It is most common in older people with high blood pressure or nervous system conditions like Parkinson's disease or other conditions that affect the part of the nervous system that controls autonomic functions such as breathing and heart rate. Certain lifestyle changes might help ease symptoms of postprandial hypertension, like eating small, low carbohydrate meals, drinking more water, and stay away from alcohol. Next type is neurally mediated hypotension. This is a blood pressure drop that happens after standing for long amounts of time. This type of low blood pressure mostly affects young adults and children. It might result from communication trouble between the heart and the brain. Next type is multiple system atrophy with orthostatic hypotension. This is a rare condition. It involves the involuntary nervous system, which controls things like the blood pressure, breathing, and heart rate. Multiple system atrophy with orthostatic hypotension is linked with having very high blood pressure while lying down. It also used to be called Shy-Drager syndrome. What are the symptoms of low blood pressure? For many people, low blood pressure goes unnoticed. Others may feel symptoms such as dizziness or feeling lightheaded, fainting or passing out, that is syncope, distorted or blurred vision, fast shallow breathing, fatigue or weakness, feeling tired, sluggish or lethargic, or feeling sick. Patient may have confusion or trouble concentrating. Agitation or other unusual changes in behavior may be present. Headache, neck or back pain may be present. Patient may have heart palpitations or feelings that the heart is skipping a beat, fluttering, or beating too hard or too fast. Patient may have symptoms like nausea or vomiting, stomach upset. For some people, low blood pressure may be a symptom of an underlying health condition. That's especially so when blood pressure drops suddenly or when low blood pressure occurs with symptoms. A sudden fall in blood pressure can be dangerous. A change of just 20 mmHg can make client feel dizzy or faint. And big drops can be life-threatening. These can happen for reasons such as serious bleeding, serious infections, or allergic reactions. Extreme low blood pressure can lead to a condition known as shock. Symptoms of shock include confusion, especially in older people, cold, clammy skin, decrease in skin color, also called pallor, rapid shallow breathing, weak and rapid pulse. For people with symptoms, the effects depend on why hypertension is happening, how fast it develops, and what caused it. Slow decrease in blood pressure happen normally, so hypertension becomes more common as people get older. Fast decrease in blood pressure means certain parts of the body aren't getting enough blood flow. That can have effects that are unpleasant, disruptive, or even dangerous. Usually, the body can automatically control the blood pressure and keep it from dropping too much. If it starts to drop, the body tries to make up for that, either by speeding up the heart rate or constricting blood vessels to make them narrower. Symptoms of hypertension happen when the body can't offset the drop in blood pressure. For many people, hypertension doesn't cause any symptoms. Many people don't even know their blood pressure is low unless they measure their blood pressure. What are the possible signs of low blood pressure or what the healthcare provider may observe? The healthcare provider may observe these signs of low blood pressure include a heart rate that is too slow or too fast, a skin color that looks lighter than it usually does, cool kneecaps, low cardiac output, that is how much blood the heart pumps, low urine output. Diagnosis and test. Hypertension itself is easy to diagnose. Taking the blood pressure is all client need to do. But figuring out why client has hypertension is another story. If client has symptoms, a healthcare provider will likely use a variety of tests to figure out why it is happening and if there is any danger to client because of it. The test may include blood test. Blood tests can help find symptoms of other conditions that can lower blood pressure. Tests on blood and urine can look for any potential problems like diabetes, vitamin deficiencies, thyroid or hormone problems, low iron levels which cause anemia, pregnancy. Imaging tests such as X-rays, computer tomography, magnetic resonance imaging. The tests look for specific problems with the heart or other body systems, include electrocardiogram, exercise stress testing, tilt table test. Tilt table test can study how the body reacts to change in position. The test involves lying on a table that is tilted to raise the upper part of the body. This mimics the movement from lying down to standing up. Straps hold the body in place. Heart rate and blood pressure are tracked during the test. Now we will see the treatment. For many people, chronic low blood pressure can be effectively treated with diet and lifestyle changes. Others need medication to manage their symptoms. Low blood pressure without symptoms or with only mild symptoms rarely require treatments. If low blood pressure causes symptoms, the treatment depends on the cause. If the cause of low blood pressure is seen clear or if no treatment exists, the goal is to raise blood pressure and relieve symptoms. Depending on the cause of the symptoms, the doctor may tell client to increase the blood pressure by making these simple changes like eating a diet higher in salt, drinking more fluids to prevent dehydration. Fluids increase blood volume and help prevent dehydration, both of which are important in treating hypertension. Drink more water, less alcohol. Alcohol is dehydrating and can lower blood pressure, even in moderation. Water boosts the amount of blood in the body and prevents dehydration. Drink more fluids during hot weather and while sick with a viral illness such as cold or flu. Taking medicines to raise the blood pressure or adjusting medicines that cause low blood pressure. If medicine causes low blood pressure, the healthcare provider may recommend changing or stopping the medicine, or the dose of medicine might be lowered. Don't change or stop taking medicine without first talking to the healthcare professional. Get regular exercise to promote blood flow. Pay attention to body positions. Gently move from lying flat or squatting to a standing position. If symptoms of low blood pressure begin while standing, cross the thighs like a pair of scissors and skews. Or put one foot on a lodge or chair and lean as far forward as client can. These moves encourage blood flow from the legs to the heart. To improve circulation, pump the feet and ankles a few times before standing up, then go slowly. When client get out of bed, sit upright on the edge of the bed for a few minutes before standing. When client have symptoms from low blood pressure, sit or lie down right away, then raise the feet above the heart level. Avoid heavy lifting. Avoid standing while on the toilet. Avoid standing still for long periods. Avoid prolonged exposure to hot water such as hot showers and spas. Eat small, low-carb meals. To avoid problems with low blood pressure and lessen episodes of dizziness after meals, try eating smaller, more frequent meals. Rest after eating. To help prevent blood pressure from dropping sharply after meals, eat small meals several times a day. Limit high carbohydrate foods such as potatoes, rice, pasta, and bread. Avoid taking drugs to lower blood pressure before meals. If needed, use elastic support or compression stockings that cover the calf and thigh. These help restrict blood flow to the legs, thus keeping more blood in the upper body. They improve blood flow from the legs to the heart. Some people have an easier time using compression belts around the stomach area than they do using compression stockings. The compression belts are called abdominal bandages. If these steps don't lessen the problem, client may need medication. Depending on the age, health, and the type of low blood pressure client have, there are various ways to treat low blood pressure. Low blood pressure treatment usually starts with finding out why it is happening. If a provider can treat that cause directly, hypotension will usually get better on its own. For example, hypotension can happen because of an injury and blood loss. Repairing that injury and replacing the lost blood with a blood transfusion will stop hypertension as long as the repair to the injury holds. The most important thing for a provider treating low blood pressure is to find the cause and correct it. Treating hypertension directly usually happens in one of three ways. Increasing blood volume. This method, also known as fluid resuscitation, it involves infusing fluids into the blood, making blood vessels constrict. Just as there are medications that lower the blood pressure by relaxing blood vessels in the body, there are also medications that have the opposite effect, changing how the body handles fluids. The kidneys are responsible for maintaining the fluid balance in the body. Certain medications can make the kidneys keep fluid and salt in the body, which can help with the low blood pressure. Treatment include fludrocortisone. This medication seems to help some types of low blood pressure. It works by promoting sodium retention by the kidneys. This causes fluid retention and some swelling, which is necessary to improve blood pressure. But sodium retention also causes a loss of potassium. So when taking fludrocortisone, make sure client get enough potassium each day. Fludrocortisone is often used to treat orthostatic hypotension. Next drug is midodrine or orvatin. This drug activates receptors on the smallest arteries and veins to boost blood pressure. It is used to increase standing blood pressure in people who have long-term orthostatic or postural hypotension related to problems with the nervous system. This medicine lessens the ability of the blood vessels to expand, which raises blood pressure. In a trauma case with hypotension and no apparent blood loss, an extended focus assessment with sonography in trauma exam may be beneficial to identify the presence of intracavitary bleeding. It is important to monitor urine output to verify those fluid resuscitation efforts are sufficient with an output of 0.5 to 1 ml per kg per hour. Along with fluid resuscitation, it is important to monitor fluid electrolytes and replace them as appropriate to avoid inducing an abnormality. If a medication is suspected to be the source, discontinue the medicine. In acute shock conditions, rapid fluid resuscitation with the cessation of bleeding is key. Vasopresses may be indicated if the mean arterial blood pressure is less than 65 mmHg. If sepsis is suspected, blood cultures and early antibiotics are essential. If anaphylaxis is suspected, intramuscular epinephrine is essential. Adding steroids for treatment of distributive shock when a patient's vasopressor requirement is continually increasing and appropriate fluid resuscitation has been done will assist in maintaining blood pressure as well. Possible complications of low blood pressure. Complications include falls. Dizziness caused by low blood pressure can make client fall or faint. Falls can result in injuries, sometimes serious ones. Falls due to low blood pressure in older adults can lead to broken hip or spine fracture. Low BP can cause heart problems or stroke. Sudden severe drops in the blood pressure starves the body of oxygen. The heart might try to make up for low blood pressure by pumping too hard or too fast. That can lead to problems like heart failure, stroke, or deep brain thrombosis. This type of low blood pressure can be life-threatening if not treated right away. Next complication is stroke. Seriously low blood pressure can limit blood supply to the organ so much that can go into shock. Low blood pressure during pregnancy can lead to an increased risk for falls.